Hey, on this medical one coming to check DCU on board. I got a 51-year-old female. She's complaining of bowel movements with dark tardy stool. She's hypersensitive. Blood pressure is G7 over 45. First outpatients acting appropriate, mainly Cantonese speaking. SpO2 is at 98% and pulse is at 130. Taking about 5 minutes.
Good morning, Alameda Hospital. This is Alameda Fire Medic 1. The People's Medic coming in code 2 is an 82-year-old male. He's complaining of shortness of breath. Levels are 130 over 73. Pulse 114. Sinus stack. Respirations 26. Setting at 93% on 4 liters. Will be at your facility in 1 minute.
Yeah, Alameda, this is Medic 1. Coming into your BW on board at 45-year-old female. She complained of chest tightness started earlier today. 12 weeks sinus. I got a blood pressure of 164, 116. It was 75. SpO2 is at 100% on room air. If you have no questions, I'll see you in about 2 minutes.
Good morning, Alameda Hospital. This is Alameda Fire Medic 1. The People's Medic coming in code 2 is a 77-year-old female. She complained of shortness of breath times 1 hour. Right now, vitals are 158 over 92, pulse 86, normal sinus respirations 20, setting at 94%. Room air. We'll be there in about 2 minutes.
Good morning, Alameda. This is Medic 3. We're in route code 2 with an 83-year-old male complaining of a swollen arm after an infusion, cancer infusion on Thursday. Vital signs are 168 over 91, pulse of 98, setting at 98%, and we're about 2 minutes out.
Good morning, all today. Berkeley Medic 2, I'm at your location, code 2 traffic. On board with 54, 54-year-old female who fell getting out of bed and struck her head. There was no loss of consciousness, no blood thinners. She does have a pretty good bump there. All vital signs are stable, GCS 15. We'll see you in about 10 minutes.
Good morning, Altavase Medic 362 coming in code 2. On board we have a 48-year-old male. Chief complaint of alcohol withdrawal. Current pressure is 116 over 82, heart rate of 115, 100% room air. Sugar was 182. If you have no questions, we'll see you in about 7 minutes. How do you copy?
Altavase, Berkeley Medic 1, coming in code 2, 5 out. 47-year-old male, NO4 GCS 15. She complained of nausea, vomiting. All vitals are stable. See you in 5 minutes.
Altavase, Berkeley Medic 5, we're inbound code 2, on board 33-year-old male. Chief complaint of weakness, maybe related to substance abuse. As of right now, the vitals are stable. We'll be there in 5, full story.
Altavase, this is Royal Tony. On board, we have a 37-year-old female, coming in as a 5150 patient. Vitals are stable and within normal limits. Patient is uncooperative and in flow point restraint. And our ETA is in 10 minutes, coming in code 2.
Altavase, this is Medic 5, code 2 traffic. On board we have a 75-year-old female. She complained of fall on the bus. Vitals are all stable. She's atraumatic epitel. NO4 GCS 15. Please come back to her in about 6 minutes. How do you copy?
Eden, this is Medic 329 coming in code 2 trauma activation. Repeat code 2 trauma activation for a 66-year-old male who suffered a unwitnessed fall, loss of consciousness, unknown, GCS 15, ANO4, no blood thinners, ANO0, no blood thinners. Patient has a laceration in the left cheek of the face, a blood pressure of 130 over 80, and a heart rate of 70. ETA 10 minutes, code 2, how do you copy?
Good morning, this is Medic 334 en route code 2 with a 75-year-old male. Chief complaint of generalized weakness, also complaining of some dysuria. We are going to sepsis alert him. Last set of vitals 110 over 80. Heart rate is 110. 97% on room air. It does feel warm to the touch. He is GCS 15, and we'll see you in about 5. How do you copy?
Good morning, Eden. This is Medic 3-3. We're coming in code 2 with a 79-year-old female. Chief complaint is altered mental status, possible psych. Currently, GCS of 10. Her baseline is GCS of 14. Otherwise, her vitals are all stable. We'll see you in about 5 minutes. How do you copy?
Good morning, Eden. Medic 325, inbound code 2 BLS, on board a 41-year-old male. Chief complaint is a dislodged feeding tube. Vitals are all stable within normal limits. We'll see you in about 10 minutes. How do you copy?
Morning, Eden. This is BLS 160 coming into code 2 sepsis with a 76-year-old female, 76-year-old female. Chief complaint of LOC, shortness of breath. We currently have vitals of a blood pressure 170 over 100, with a heart rate of 98. And breathing about anywhere between 40 to 50 times a minute. It's not 100% on room air, however. She is ANO 0 at this time. She's ANO 1 baseline. We got a GCS of 13 on her, and we got a sugar of 250. We'll be there in roughly 5 minutes. Code 2 for now. How do you copy?
Good morning, Eden. This is Medic 323 coming in again. On board, we have a 98-year-old female. She's coming in today for hip pain, right-sided hip pain. Patient today had a ground level fall, no significant head injury. Patient is not on blood thinners. She's alert and oriented 2, GCS 14. She's at her baseline. Mental status per family on scene. Vitals are 153 over 73, 100% on room air, heart rate of 70, blood sugar of 75. We are 5 minutes away, code 2. How do you copy?
Good morning, this is Medic 332. We're coming in code 2 with a 67-year-old male who had 2 seizures. He's currently acting at his baseline of pain of 2, GCS 14. Vitals are 130 over 76, heart rate of 130, setting at 97%. Room